Hello, my name is Andrew, and this is Vlog 1, Skills and Capacities in the Weight Room. Athlete 1 is a skill issue in the back squat, with the hip twist in the concentric phase and hips rising faster than the shoulders in the dead squat. Athlete 1 is a capacity issue in the single leg squat, with a 17-degree Q angle, 16 degrees of valgus in standing, a wide hip to waist ratio of 0.83, and a weak glute medius on testing. Athlete 2 has a capacity issue in the back squat, with limited right ankle dorsiflexion resulting in a forward lean and slight heel raise. In the single leg squat, Athlete 2 has a skill issue, who is unable to maintain balance, shows excessive arm movement, and a loss of lumbar lordosis. For this vlog, I'll be using the technical model provided by Myers et al. 2014 to assess the athlete's execution in the back squat. Using this technical model, I will assess head position, thoracic position, trunk position, hip position, frontal knee position, tibial progression angle, foot position, descent, depth, and ascent. From the posterior viewpoint, we can see the athlete has retracted a scapula, keeping the elbows medial to the hands. The athlete adopts a narrow stance and approximately 3 seconds into the lift displays a hip twist in the concentric phase. The hip twist is unlikely to be a mobility issue since it's on the concentric phase of the lift. It is unlikely to be a deficit in quad strength given the position of the lift and a similar limb symmetry index on the single leg extension. Also, it's unlikely to be a deficit in glute max strength given a similar limb symmetry index on the single leg press. The hip twist could be a result of a motor control issue with an asymmetrical timing of the glute contraction, with the right contracting quicker than the left. The athlete also tests comparatively weak on manual muscle testing of the left and right glute medius and is able to maintain the position against gravity but unable to resist extra resistance and is graded 3 plus out of 5 plus. But the weakness in the glute medius does not explain the asymmetrical anti-clockwise twist of the hips, leading me to the conclusion that it's a motor control issue and characterized as a skill deficit. From the diagonal viewpoint, we can see the athlete holds his shoulder in extension, which minimizes the engagement and stiffness generated from the latissimus dorsi. Cueing the athlete to drive the elbows under the bar will generate maximal tension from the latissimus dorsi and rhomboids. Also, the athlete has minimal change in the trunk inclination and keeps an upward chest and a consistent amount of lumbar lordosis throughout the lift. From the lateral viewpoint, we can see a parallel shin and trunk angle with a forward gaze. We can see the athlete does not show an excessive amount of anterior knee translation, as they maintain a parallel hip and knee angle in the bottom position, which helps avoid unnecessary torque at the knee. The heel remains in contact with the ground, even when the knee translates forward, preventing excessive torques at the ankles, knees, hips, and lumbar spine. Also, we can see the barbell path remains vertical throughout the lift and the center of mass is just in front of the ankle, which encourages a balanced pressure between the heel and forefoot. The hip and knee moment arms and similar joint angles suggest a weightlifting style squat that utilizes more of the quadriceps relative to a powerlifting style squat, which utilizes more of the hip. The athlete reaches the parallel thigh position, which also encourages a greater demand on the quadriceps. We can see the knees are kept forward out of the bottom position to the above parallel thigh position, which uses the quadriceps in a position that they are most effective. In the ascent phase, the torso remains straight with a neutral lumbar and a simultaneous extension of the hip and knee. From a frontal viewpoint, the pelvis remains horizontal with the left knee moving laterally away from the left foot. Also, there is a slight pronation of the left foot. Looking at the kinematics of the lift, the vertical velocity of the bar takes place approximately 3 seconds. The angular velocity and angle of the hip suggest a simultaneous unlocking of the knee and hip, which is in contrast to the technical model's criteria, which suggests initially unlocking at the hip, which is proposed to shift the weight to the posterior chain and be a stated strategy for the lumbar spine. Looking at the speed, a sticking point seems to have occurred after approximately 2 seconds, evident by the small dip after initiating the ascent. In summary, we can see the lift was performed with a forward gaze, though potentially with a forward head position, an upward chest, shoulder blades retracted, with the shin and trunk angle parallel to one another while maintaining a lordotic curve. The line of hips is parallel to the ground, but the lateral aspect of the knee crosses the lateral malleolus, which causes a pronation in the left foot. The heel remains in contact with the ground, even when the knees move forward, suggesting the knees do not anteriorly translate excessively. The descent is upright with the simultaneous unlocking of the hip and knee at a constant speed. It is interesting to note the rapid descent of the squat, as according to Myers 2014, a rapid descent is considered a deficit, as high velocity eccentric movements can be dangerous if the muscles are forced to stretch in a short amount of time. The depth is sufficient as the thighs are parallel to the floor. In the ascent, we can see similar angular velocity and joint angles between the hip and knee, suggesting the hips and shoulders rise at a constant speed, but the bar path moves posteriorly, potentially to overcome a sticking point. If we compare a maximal lift with a submaximal lift, we can see a similar vertical and angular velocity. According to Tiller 2019, high velocity descent may use the stretch shortening cycle to minimize the sticking point. Without the use of a high velocity descent, we can see the hips rising faster than the shoulders, visually and kinematically. Therefore, the athlete may rely too much on the stretch shortening cycle to complete the squat. The athlete is cued to separate the floor or rip the floor in two to encourage a greater glute contraction. Slow and fast-banded hip thrusters are given to the athlete to address the hip twist in the ascent that may encourage an appropriate timing of the glute contraction. A front squat off the pins is given to the athlete to encourage a simultaneous extension of the hip and knee. From a posterior point of view, the athlete adopts a slightly wide stance. With the elbows outside of the hands, this minimizes the engagement of the rhomboids, and the athlete displays a hip shift to the left on the ascent of the squat, which, if not addressed, could lead to a reliance on the left-hand side, further ingraining of faulty engram. The athlete shows no hip shift and quadruped rocking, which suggests the ankles may be a factor in the athlete's hip shift in the ascent of the squat. With the knee to wall test, the athlete tests comparatively tighter in the right ankle, scoring 10 cm while the left ankle scores 12 cm. Also, the athlete has equal passive hip flexion with minimal lumbar pressure to the hand. Therefore, this leads me to the conclusion that the athlete's hip shift in the ascent of the squat is caused by a capacity issue in the right ankle. From the lateral viewpoint, we can see the athlete has an asymmetrical shin and trunk ankle, forward gaze, and a slight heel raise with a flat lumbar. The slight heel raise may indicate the knee is translating excessively forward due to the limited ankle dorsiflexion in the right ankle. Also, we see the bar path move slightly horizontal with the center of mass slightly pushed forward into the forefoot, which could increase torques at the ankle, knees, and hips, potentially resulting in injury. From a frontal viewpoint, the athlete holds an upward chest with the hips parallel to the ground and knees tracking the direction of the toes. Looking at the kinematics of the lift, the vertical velocity of the bar takes place approximately over 3 seconds. The angular kinematics and angle of the hip and knee suggest a simultaneous unlocking of the hip and knee, but with a greater reliance on the hip, increasing shear at the lumbar spine. Also, the bar moves horizontally, further increasing shear through the lumbar spine, possibly as a consequence of the limited ankle mobility. In summary, the athlete has a forward gaze, upward chest, and shoulder blades retracted. The shin and trunk are not parallel with a flat lumbar. The line of hips is parallel to the ground with a weight shift to the left. The knees track the toes, but the knees may slightly anteriorly translate excessively due to the slight heel raise. The descent is upright, primarily using a hip stretch at a constant speed, but the bar path translates horizontally. The depth is sufficient as the thighs are parallel to the floor. Looking at the kinematics of the lift, the hips and knees extend at a relative constant speed, suggesting the shoulders and the hips rise at a constant speed too. The athlete also has a hip shift to the left on the ascent out to the bottom position. The athlete is cued to slow down the motion to encourage a symmetrical shin and trunk angle and maintain tension in the quads. A counterbalance squat is given for the forward lean to train the upright position while mobilizing the ankle in the squat position. A banded ankle dorsiflexion stretch is given to increase the knee to wall distance, which will hopefully address the hip shift and slight heel raise in the squat. For the single leg squat, I'll be using a technical model provided by Harrington et al. 2013. From the anterior viewpoint, the athlete stands with a large Q angle and knee valgus, which is 7 and 6 degrees more than ideal. Also, the athlete stands with the knee pointing towards the second toe, and as the athlete descends into the single leg squat, the knee valgus increases, which could place additional load on the knee ligaments during single leg dynamic activities. The large Q angle is unlikely to have a dynamic cause as the supine Q angle is 20 degrees. The large hip to waist ratio may explain the athlete's Q angle, suggesting a relatively long neck of femur, which may also explain the preference for a narrow stance squat. Therefore, as a result of their anthropometrics, they are characterized as having a capacity issue in the single leg squat. From the lateral viewpoint, the athlete does not reach the required 65 degrees of hip flexion proposed by Bailey 2010, has a forward gaze but an asymmetrical shin and trunk ankle, which may increase shear of the knee. Also, we see the vertical displacement moves horizontally, with a slight heel raise suggesting further shear is put through the knee joint. The center of mass is in the toes, placing further strain on the knee joint. In summary, the athlete scores 2 out of 10 in the single leg squat. Though the knee pointing towards the second toe could be the result of the athlete's large Q angle and hip to waist ratio. To encourage a symmetrical shin and trunk ankle, the athlete is cued to imagine sitting back into a chair to shift the center of mass more to the midfoot, which may reduce shear at the knee. The athlete's large Q angle and subsequent knee valgus may have limited ability to change, but may indirectly benefit from addressing the weakness in the glute medius. From the anterior viewpoint, the athlete has an unsteady descent with a slight knee wobble. The athlete performs poorly in a single leg balance test and is unable to reach the 30 seconds proposed by Trojan 2006. The knee wobble arm movement, looking downward at the foot, suggests the athlete is unfamiliar with the movement and is therefore characterized as a skill issue. From the lateral viewpoint, the athlete does not reach the required 65 degrees of hip flexion with an asymmetrical trunk angle. Downward gaze on loss of lumbar curve before parallel, suggesting spinal flexion occurred, which may indicate a risk when picking up objects from the floor. Similar to the previous athlete, the vertical displacement moves horizontally, suggesting relatively more pressure in the foot, but with the center of mass remaining in the midfoot. In summary, the athlete scores 2 out of 10 in the single leg squat, and uses the arms to balance and leans forward before the thigh parallel position. The athlete is cued to keep a fixed gaze on a point without extending the neck to discourage a forward lean. Also, the athlete is given a single leg squat with hands on a wall to learn how to control the single leg descent in a safe manner.